Good evening, everyone. This is Dr. Ross Nash from Huntersville, North Carolina, and it's my pleasure to speak for Viva Learning tonight, sponsored by Colteen. And I want to talk to you about an indirect approach to direct composite veneers. I think the best way to start the program is simply by looking at our patient. This is a beautiful young woman, as you can see, who presented to my office, and she was interested in replacing the direct composite veneers that she had on her 6 maxillary anterior teeth. They had been in place several years, and she'd been happy with them, but they were looking worn, and she really wanted a lighter color. She was in excellent dental health, so she's a good candidate for elective dentistry. Let's just look at her case to begin with. You can see here's her smile, and the maxillary teeth. Here, my pointer. Excuse me, my brother was showing me where my pointer was. So the maxillary 6 anterior teeth, as you can see, have been bonded with direct composite veneers, and I'm sure that they looked really nice when they were replaced, but now they're beginning to look somewhat worn. Here's the proximal view. You can see the dentist stopped with the canine, and I think you'll see that it's better to go on past the canine. And here's the other side. Now, the reason for her original direct composite veneers, and as you can see, her dentistry, her dental situation is excellent. Her dental health is excellent. She's got beautiful tissue, and there's no active disease. Our clinical examination evaluated a patient or described a patient that is in excellent dental health, and anything that she would have done is elective, and so were those original direct composite veneers. They were placed because of the white decalcification that you can see she has on a lot of her teeth, and that bothered her on her anterior teeth. So the dentist was just trying to help her resurface those teeth to make them more aesthetic. Here's the incisal view, and you can see the veneers are very thin. They're not thick veneers, and perhaps they have worn down a bit with time, but they were very conservatively done. Another retracted proximal view, and as you can see, the canine to canine were bonded with direct composite veneers, and they're beginning to wear at the tissue level, and you can see they're getting thin, a little stained along the margins there, but have held up fairly well. Well, the difference here is this particular patient said the veneers were never very white, but they did cover the white spots, and she was looking for, as many of our patients are today, this Hollywood white color. Well, it's hard to place a Hollywood white color on 6 front teeth and not go past the canines. In fact, if you can look, the smile zone really demands that we include at least the first premolar here on both sides in order to take that color and look around the corner. Oftentimes we even go back to the second premolar, but she decided that she would like to stick with the upper 8 anterior teeth. So here are our treatment options. Certainly we could remove those composite veneers and very conservatively prepare the maxillary 8 anterior teeth, most anterior teeth, including the first premolars, and take an impression, send the impression to the lab, and have some very thin porcelain veneers made. That would be an option. Certainly porcelain is the longest lasting tooth-colored restorative material that I've been able to find, and it's stain resistant and durable, so it is kind of the Cadillac of treatments today as far as resurfacing the teeth. But we can also use a freehand layered composite resin technique, as was done with her in the previous case when she had her veneers done several years before. Freehand layered composite does take the ability of the provider, and most of the time it's a dentist, although there are I think 16 states in the United States where expanded duty dental assistants can actually place these restorations, but it does take an artistic approach. It's not just color, putting a new color in the surface, but it's actually contour, anatomy. It's more than just resurfacing the tooth with a thin layer of material. You must be able to create the look of a tooth. So it's an art. It's a real art. Some dentists have more artistic ability than others, and over my years of teaching direct composite veneers, the biggest frustration I have heard from some of my colleagues has been that they just didn't feel like they could achieve the aesthetic result that they wanted with their own hands, and that's why they like the opportunity to choose an artist like a ceramist to place the porcelain veneers instead. Well, another way to do this type procedure would be with an assisted direct composite veneer technique, which really conquers some of those artistic problems, and I'm going to talk to you about that in just a minute. So let's look and see. This particular patient looked at her options, and she chose the direct composite veneer approach for two reasons, really. It was more affordable for her. In my practice, I can place a direct composite veneer for about half of the cost of an indirect restoration because my costs are less. They're more affordable for many people today, and they can be done in a single appointment, where indirect veneers normally take 2 appointments, and they're often several weeks apart by the way we arrange things. Now, certainly if you have a CAD/CAM machine in your office and you can produce your own on-site ceramic restorations, that's different, but most of us send these to the lab. So it's a 2-appointment technique, and it's a higher fee for the patient. She decided on the direct composite veneers because of the affordability and the single appointment technique. I frankly felt that I could do an excellent job in this case with an assisted direct composite veneer technique, and I'm going to talk to you about that. The assisted composite, the direct composite veneer technique that I'm talking about certainly is the Composite technique by Coltine. There are some competitive products out there that had pre-made composite facings that can be used to help in a direct composite technique, very similar to this one, but this one is my favorite, and I've got a lot of experience with Composite. What is a Composite? Composite is a pre-polymerized, prefabricated, enamel-shaded composite laminate. Now, these were invented in Switzerland by a genius of a dentist, I think. What's his name, Claudia? The dentist who invented Composites? I'll think of it in just a minute. I should have written that down. Fantastic dentist. I met him when I was in Zurich. And anyway, he decided that he should make some preformed enamel-shaded laminates. Now, these are made under pressure with light cured under pressure. And they have several different forms: small, medium, large, extra large. But it really is a restorative scaffolding serving as an anatomical guide for the restoration, because a lot of the anatomy problems that dentists were having are built into this material. And it is actually the enamel layer. In fact, it's made of the same exact material as the luting composite, which finishes the actual restoration. And it's Synergy D6 composite by Coltine. It's a nanohybrid composite that I use on direct restorations in the mouth also. But when laminated together, these two products, these two materials, Synergy D6 body composite, whatever color you choose, whether it's another enamel shade or a dentin shade underneath, is actually luted together and cured together with this enamel facing, and it becomes just as if you layered it freehand. You really can't separate the two. So it's a very nice way to place direct composites. And I can place them quicker, frankly. I can place a direct composite Composite in about 30 minutes. It often takes me an hour to do a freehand layered. So it can be more efficient for me. But as far as the end product, it's a very similar product. So this is the kit that you can see on the market that Coltine has, and has all the different materials in it. It has the different sizes of Composites, both the maxillary and mandibular. It also has the the composites, D6 Synergy composite. In the kit, it has the sizing guides. It also has the instruments and the bonding agents that you need to use. So it's a complete kit. And this is what a Componeer looks like. You see, it's the enamel, and not only the enamel, it's also got the translucent color, but it has the anatomy built in. And of course, you do have small, medium, large, extra large, and these are to be shaped to fit as close to the tooth that you're trying to veneer as possible. And then I'll show you how you go on from there. But those are all Componeers. They're actually packaged very nicely in these hygienic color-coded packaging, and you can actually use it as documentation. It says Direct Composite Veneer on the back side when you peel that off. This is an instrument that Colteen came up with. It's actually, as you can see, an articulating paper holder, but they placed some little rubber tips on there, and you can actually hold a Componeer in place while you're placing the different chemicals that I'm going to show you, a bonding agent and a eluting composite inside. Don't try this with a porcelain veneer. One of the things you probably would like to know is that one of the advantages of composite over ceramics is that composites are resilient because of the resin matrix. They actually bend before they break, so they're more flexible. Ceramics, even though they're strong materials, if you bend them, they're going to break. So this resiliency in composite allows us to use this instrument. You can also reshape the composites with sandpaper discs and make them fit as close as you can. And that's desirable. So these are shaped, can be shaped to fit. So let's look at the technique, and I'd like to show you another case besides our patient, but I'm going to take you through the actual a case that I placed these Componeers on directly on the teeth, and that's how they were designed to do. First, you prepare the teeth, and then you lute the composite of the Componeers, which is the enamel shade, using a body shade, whether it is an enamel shade itself, if you're just wanting an enamel layer, but if you need a dentin shade underneath to develop the tooth-looking appearance, you can use dentin. Most often, I do use a dentin shade. And then you finish it and polish it, so just like a direct veneer. But let's look at this first case. So this particular patient is interested in some kind of veneer for her 6 anterior teeth, and we chose Componeers, or she chose them, after looking at her options. And here's the incisal view of that particular patient. And here is the dentin shade guide that we're using. The nice thing about the dentin colors is they actually fit into the enamel shade, which is this one. There are 2 enamel shades, white opalescence and universal, and there are a number, I'm going to go back here, a number of the dentin shades available, and this is an A1 shade, I believe, if I remember correctly, but that little dentin shade fits inside the enamel shade. As you can see, it telescopes right in there, and you can actually see what the color is going to look like when you blend them, and I think that's beneficial. I'll go back and show you the dentin shade, the enamel shade, and there they are blended together, and that's the shade she wanted her teeth to be. Here's the sizing guide, and of course she turned out to be large, and we chose the large shade there. I mean the large size. So here we're just taking a fine diamond. Oftentimes the anesthetic is not needed for the conservative preparation that is done for these. The Componeers themselves are 0.3 of a millimeter in thickness, and right in the middle, and then they feather out to nothing at the margin. So you want to be sure unless you want a bolder look, a little more contour, then you can actually take about 0.3 of a millimeter off the facial and have the same facial contour. By the way, my brother just gave me a note, and the inventor of Componeers is Mario Bessick. He's just a brilliant dentist in Zurich, Switzerland. All right. Anyway, so here's the preparation is about 3/10 in the middle, and then it just feathers out to the edge. So this particular patient has some class 3s and class 4 areas that needed to be filled in also, and you can see those have been prepared also. So after you prepare the tea, then we are going to choose our size. Of course, we've already chosen the large here, and then we're going to try in the Composeres. Now, they may need some shaping, and you can see we're using a Swiss Flex disc here to shape the margins, and we want to get as close to the shape of the tooth or the size of the tooth as we can, and you can see the incisal view here of the tri-end. These fit very well. Now, the thing about it is you really can't loop these to place with a, go back here, let me go back just a second. You can't loop these to place with a flowable composite. I had one dentist that went to my course up in Canada that came to a second course that I gave on this particular topic, and he was frustrated because he said his just weren't looking right, and then he realized he was just trying to loop these enamel facings with flowable composite. They don't fit intimately like a porcelain veneer. You have to build the intimate fit with the luting composite, which becomes a part of the restoration, and that's what we're going to see. Once you do that, they fit intimately, and here we're going to bond them directly to the tooth. But you have to use a restorative composite, specifically designed to use with Synergy D6 to build the internal surface so that it does fit intimately. So at this point, we're going to acid etch the tooth that we're going to place. I like to place these really one at a time. Just 10 seconds with phosphoric etch, and you can see that it's being rinsed off, and there's that beautiful etched enamel surface that we love to see and we know is very, very bondable. Then I'm going to place a bonding agent. This is Coltene's bonding agent. One coat bond by Coltene. And we're going to massage that in for about 20 seconds and then blow it then, getting rid of the alcohol or acetone carrier, whatever's in bonding agents, and leaving only the resin. I like to light cure it. Some people don't light cure at this point, but I like to light cure that bonding agent so that we know you got that good bond to the natural tooth. And then I'm going to come back here, and on the internal surface of the Composeres, we put some bonding resin also, and it just acts as a wetting solution, rather than a wetting agent, rather than a bonding agent. We don't cure this. We just thin it out and allow it to help the composite that we're going to place in here flow better. And this is Synergy D6 composite, and as you can see, I'm just using one of their instruments to coat the internal surface, and you want to bring it all the way to the margins, but I wanted to show you that it has a significant coverage on the internal surface of the enamel there. And by the way, these Composeres are ready to bond. You don't have to sandblast them. You don't have to put any chemicals in there. You simply make sure they're clean and dry, and you place your bonding agent, then your composite. And then you also want to place some of your Synergy composite on the tooth itself, because we find out if you don't do that, it's possible that you can get some voids. So you should place a layer of your luting composite on the tooth as well as on the internal surface of the Composite. And here I'm bringing the Composite to place, and then you're using this instrument. It's called a placer, and it's just got a little silicone tip on it. But again, don't use this on porcelain, but you can actually press this Composite to place. It'll extrude the excess material around the margins, the internal surface there. That's the Synergy D6, and then you just clean off the margins. And the nice thing about this material, by the way, this particular composite by Coltene, is that it has enough what the word I'm looking for, enough rigidity that the Composite will actually stay in place while you clean it up. Some of the composites, and you can use other composites inside a Composite, but some of the composites are more flowable, more creamy, and it's harder to keep it in place while you're cleaning it up. So I particularly like Synergy for this also. So I clean up the excess and basically get the Composite in the position that you want, and then go ahead and light cure it and just tack it in place. And then you can do some more cleanup if you like at that point. At this point, I finished the cure. So, I want a good 20 seconds on the facial and lingual with a normal light curing unit, an LED. And then we're ready to finish. Now, this is just like any other direct composite at this point, where if I had taken time to layer placement bonding agent, placement bonding agent, layer my dent and shade, overlay it with an enamel shade, contouring all the way, and then also even an incisal, that's what takes the time. Here, I've been able to do that in just 2 short steps. And now I'm using my carbide finishing burrs and all the other items that I use to normally contour direct composite veneers. I'm using the Swiss Flex aluminum oxide strips here on the proximals, and we just finish that in a normal way that you would any direct composite. Here I'm adding my second direct composite veneer, and that's on the central with bonding agent. Added the comp veneer, cleaning up the body shade, light curing, the same type of finishing all the way through. And these are polishing, Alpen polishing points. And this beautiful little brush that we use to finalize it, and you get this really nice look. So 6 comp veneers placed on these teeth, and that's the way they were actually intended to do, to place them direct. Those are direct composite veneers. And you can see the marginal adaptation here is just excellent with these materials. You can't even feel the margins with an Explorer. You can't, if you have any voids at all, you can just fill it in with flowable composite, and you just never know. So they fit very well. It takes me about 30 minutes per tooth to place a direct comp veneer like this. So let's go back to our patient. This is the patient that would like to have has chosen 8 direct composite veneers for her maxillary arch. I have chosen to use comp veneers, and she's agreed. So here's the preparation, and again, a case like this, it's not uncommon that I don't even need any anesthetic here. We use lots of water. This is one of the Alpen burrs. You can use fine finishing diamonds. You can even remove that composite with a carbide finishing burr and then finally shape. So in this particular patient, we didn't need anesthetic at all for this. And there are the preparations. Minimal preps, all in enamel, 100% enamel preparation. And that's what I'm looking for. I don't want to do something aggressive on these beautiful teeth. So they're prepared. And you can see here's her occluded view, the proximal view with all 8 maxillary anterior teeth prepared for comp veneers. And here's the incisal view. Now, at this point, I talked to my assistant, who's actually a hygienist, and she is also a lab technician. In fact, she trained as a dentist in Colombia, South America. Her name is Claudia Waddell, RDH, but she's a fantastic lab technician. She does a lot of these things for me. And we talked about the possibility, and we had been speaking about placing comp veneers in an indirect technique, which would allow the patient to be in the chair less time and also less doctor time. And we thought this would be a great case for that. So Claudia asked me to take an alginate impression, which I did, of that particular prepared teeth. And so I've spent about 30 minutes here. I spent just some minimal time with removing the old composite and preparing the teeth and taking an alginate impression. That's about 30 minutes of my time. And then I handed the impression to Claudia. Well, at this point, Claudia took this alginate impression, and she's going to make a flexible model. Now, you can make a hard stone model and build these things in the lab on a stone model if you like, but with a stone model, you have to worry about a separator. They tend to chip and break while you're fabricating. So we decided to use Parkell's mock slow dye silicone. It is actually a model material, a silicone model material, and I'm going to show you that in just a minute. So Claudia injected the model material into the alginate impression with a vibrator. It flows extremely well and flows almost like a stone, and then added directly this mousse bite, Parkel's mousse bite, as a base. And this is what it looked like after she poured it. And you see the base is there. Inside is the Mach 2 material. And when she pulled and shaped the model, that's what it looked like. That took her less than 30 minutes. So here's our model. Now, on the nice thing, we go back. The nice thing about this material, this disilicone, is that it needs no separating agent, and it is flexible enough that it does not cause the materials to break, and it doesn't break itself. It's a wonderful dye material for this technique. So at this point, she's going to select the size. Use the sizing guide. We have already selected the white opalescence enamel shade, and also you're going to see that she used the bleach white Denton shade, because remember, this lady wants Hollywood white color, so we're going to make it as white as we can. So we use the sizing guide, and she's a large. We're going to use the white opalescence Composeite itself, which is the enamel shade, and then she's going to fit and adjust with some Alpine Swiss Flex instruments. And I'll show you. These are the Composeiters. Now you notice that we have 8, not 6. And the Composeiters in the United States only come canine to canine. And so what Claudia did was take 2 canines and reshape those for premolars, and that worked very, very well. So here she is. And by the way, Claudia made all of these images from a video. She used her little iPad to video what she was doing, and then made these pictures for me. So she's using a 15 blade just to section these so she can get in approximately each one of those. And then she's fitting the Composeiter, the central, and she's shaping the different Composeiters to make sure they fit as good as possible. And she's doing some more fitting, shaping, sizing, fitting, shaping. Each one is fit to the individual teeth. There's the canine, and she has the canine and the lateral together on the model. And then she's got them all fitted, and then she actually put a little bit of the celluloid strips between each of the teeth where she is sectioned. And at this point, the steps are to take the bonding agent and apply it to the internal surface. The one coat bond by Colting is what we use, and then of course she's using the bleach Denton shade VL Synergy D6 by Colting. That's going to be applied to the internal surfaces after she wets with the bonding agent. Each Composeiter will be pressed to place. Excess composite will be cleaned just as it was. I showed you in the mouth on the direct case, and then the composite veneers will be light cured. So let's look at the steps. Here's the bonding agent. It's one coat bond by Colting. She's placing them on the internal surfaces. She's wetting each of those, and she's going to dry that with compressed air. Just blow it thin. Here she's adding the Denton shade, bleach shade, which is the body shade we call it, over inside the enamel. And here she can go directly to the tooth. She doesn't need to put any on the tooth here because she can see whether she's got any voids or not. And she's fitting them to the tooth. She's fitting the first one. She's using her placer to press it down just as I did in the mouth for the patient. Removing excess around the margins just as I did in the mouth. Placing the second one at this time. Now she hasn't cured anything at this point. What she decided to do was place all of them at one time without curing, and then she could adjust shape and contours and positioning. And I thought that was a good idea. So here she's placing the second one, cleaning up the margins. He's over here to the canine by now, placing the canine. Cleaning up the margins. You can see they're all going on. Over to the other canine. One by one, fitting, placing the internal body material inside, making sure they fit. Cleaning up. Here's the premolar. And then she'll pull her strips and light cure. So at this point, she's going to remove each of those cured composites. Excuse me, she's going to remove each of those cured composites, finish the margins, and clean the internal surfaces, and she'll just sandblast those a little bit. But here she's removing a few of them off the teeth, and you can see now it fits intimately. Now this veneer can be bonded to place with any luting agent, any composite luting agent. And you can actually, there's some advantages to that, because you could change the color. You could actually put something lighter on the internal surface, or you can use a translucent material. There are lots of advantages here. But she's going to finish and polish these margins and make sure they fit just perfectly. So here's the finished case on the model. Those were her video pictures. These were some digital images that I took. And you can see we've got the body shade, the white body shade she was looking for, and then this beautiful translucent enamel shade with anatomy. Here they are just laying on a blue cloth. You can see the internal structure there that we have created. There's the enamel facial veneer, and here's the internal structure we've developed that fits intimately now to the tooth. Time in the lab took Claudia about 2 hours. So I've got 30 minutes, and then I was through. I could go do other things. Claudia spent 2 hours fabricating these, and fabricating the model and the veneers. During this period of time, the patient can relax, or she can leave and come back. She could certainly come back tomorrow if she wanted to, but this can be done in a single day. And some of my patients have chosen to stay. Some have just left and gone and come back. But it gives them that opportunity not to have to be in the chair that particular 2-hour period of time. Now I'm going to try these in. And here's the patient back in the chair. These are tried in. I just use a little water as a trying medium. We take a look at them and see how they look on the teeth. You can see how intimately they fit, and just with a drop of water they stay on fairly well, and she can judge them, and of course she approved them. So at this point we're going to go through our bonding procedure. We're going to etch, rinse, dry, apply our luting agent, and we're going to bond it to place. Now you can use a material that uses a bonding agent and then a luting composite, and we do that sometimes. In this particular case, I used a self-adhesive luting agent by Taub called Fusion ZR. This is a video, and I'm going to just push this little arrow here, and you're going to watch it. This is sped up quite a bit. So here I'm placing two of the centrals together. So I'm protecting the adjacent teeth with just some little metal strips at Toffemeyer's that we cut down a little bit. Now I'm rinsing. As you can see, this is speeded up quite a bit. And there's that beautiful etched enamel surface that we know we can bond to. On the internal surface of the veneers, rather than use a bonding agent and then some luting composite or just some luting composite, I just placed the self-adhesive Fusion ZR by Taub. And you can see why I like the material, because of the cleanup. Watch this. There's no bonding agent necessary either on etched enamel, by the way. So this is just self-adhesive luting agent, and it's called Fusion ZR. But see how easily it cleans up. And then I can actually run some floss in there and go ahead and cure. Clean up the excess at the margins on the proximal areas where I'm going to add the next tooth, the next veneer, so that it can be seated. But I just take a little metal interproximal strip, diamond strip there, just to free up that area, and then place the next two in the same exact fashion. I'm acid etching, I'm rinsing. We're going to place the luting agent inside the Composite and then directly on the teeth. And look how nicely this cleans up. Well, I can clean this up with an Explorer. That's one of the reasons I like this particular material for this particular treatment. And you can see I'm using that just a little instrument to hold those to place, and as I'm cleaning up the material, they still stay in place. And you can see I can even run some floss in approximately. That wasn't me, that was my assistant. I was holding both in place. And then we light cure. And then we're down to the premolar now. We're etching, rinsing, the same exact procedure. Dry it, go directly with the self-adhesive cement or luting agent. That's Fusion ZR. Clean it up and light cure. Now I've got everything's all 8 have been bonded to place, and I'm just using a little carbide finishing burr, a little 8 fluted carbide burr to go along up the margins, just as I would with any other direct composite technique. Just finishing, polishing. I can actually change surface shape if I want to on this particular this material and repolish back to its original gloss. Checking the occlusion, getting rid of any excess on the lingual areas and any occlusal adjustments I need to make, and then we're going to finish with the Colting's points and cups. They have points cups polishing system. That's 2 grits and then this wonderful, I call it a compo brush, which brings that surface up to that fantastic shine. And this just took me about an hour and a half to place stuff, a little under that actually. So we'll go on to our next picture. These are the final restorations in place, and you can see we've got 8 direct veneers actually. However, that work that was done to fit them and shape them and make sure that I could place them with luting agents was done in the laboratory by Claudia rather than for me having to do it all myself. So my time and the patient's time was only about 90 minutes in this particular case. And so what happened if you take my hour, that 30 minutes for the prep and impression, and my 90 minutes to place, that if you divide the 8 Composite by that only left me 15 minutes a tooth is all it took. Where a normal Composite placement, I allow 30 minutes per tooth. So I saved half of my time, and during that particular time, I didn't have to be at the chair, and neither did the patient. All that work can be done in the laboratory. So I really enjoyed that, and the patient loved it. Let me show you the final result. You can see the proximal areas here. Here's the biting picture. You actually see the incisal edges. In the frontal view, you can see that by taking the Composite around to at least the first premolar, it really finishes the smile rather than stopping it at the canine. And here's the smile from the facial aspect and the other side. So that's a pretty good before and after shot right there, and you can see the advantages. One of the things that I have found, by the way, with the Composite is that that particular surface, I find very few voids. In fact, I can't remember a single void in the hundreds of Composites that I've placed, where when I place them freehand, I sometimes find a little pit or void here, and it just doesn't happen with Composites. I think it's because they are pressure cured, light cured under pressure, and I think that pressure eliminates almost all porosity. So the surface is an excellent surface, and I find that it maintains its polish very, very well. There's the incisal view, and again you can see how beautiful this marginal integrity is. It's not always that way, even with porcelain veneers, but you can't even feel those margins with an Explorer. And of course, I think you can see she wanted a slightly a slightly broader contour on her teeth, a little wider smile. So we were able to actually remove very little facial tooth structure as far as thickness goes. And this is a little bit thicker than her originals were, but that's what she was looking for, a broader smile. And again, here's her before and after from the facial view. And look how healthy that tissue is around the margins. And that's what I'm looking for. You really want to have patients that maintain, but when you start with healthy tissue like this, it's a good place to go. And then this is the lovely young lady, very happy with her new smile. And there we are together. Now we actually have 19 minutes left. I've done pretty well. If you have some questions, I'd like you to go ahead and send them in now, because I can certainly answer those questions. But what I would like to talk about, as I'm waiting for you to do that, is that you can learn these types of procedures. In fact, let me go one slide forward, and that's my thank you slide. And my lovely wife Deborah and I at the Nash Institute. There's my contact information. If anybody would like to contact us, we're at the Nash Institute for Dental Learning in Huntersville, North Carolina, right outside of Charlotte. Our website is www.thenashinstitute.com, and you can see our telephone number, 704-766-0025, and then you can actually email us at nashinstitute.dentallearning@gmail.com.